Assalamualaikum friends, hope so you are all doing good. Welcome back to another video on my YouTube channel Medical World. In this video we are discussing about the thyroid gland, body gland. The thyroid gland is an endocrine structure located in the neck. It plays a key role in regulating the metabolic rate of the body. In this article, we shall look at the anatomy of the thyroid gland, its position, blood supply, and clinical correlations. First of all, we are discussing the anatomical location of thyroid gland. The thyroid gland is located in the anterior neck and spans the C5 and T1 vertebra. It consists of two lobes, left and right, which are connected by central isthmus anteriorly. This produces a butterfly-shaped appearance. The lobes of the thyroid gland are wrapped around the cricoid cartilage and superior wings of the trachea. The gland is located within the visceral compartment of the neck along with the trachea, esophagus and pharynx. This compartment is bound by the pretracheal fascia. You can see in this picture the thyroid gland. The thyroid gland has first of all upper portion thyroid cartilage of the larynx, next portion cricoid cartilage, then left lobe and right lobe. Then at the end you can see the trachea and isthmus. Next we are discussing about the anatomical relations of thyroid gland. The thyroid gland is closely associated with the numerous other structures in the anterior neck, anteriorly, laterally and medially. You can also see in the diagram given below. First of all, anteriorly. Anteriorly, infrahyoid muscles, namely the sternothyroid, superior belly of the omohyoid and sternohyoid. Next, laterally. Carotid sheath containing the common carotid artery, internal jugular vein and vagus nerve. Next, medially. Organs, larynx, pharynx, trachea and esophagus. Nervia, external laryngeal and recurrent laryngeal. You can see in the diagram clearly. First of all, on the top sternohyoid, then on the right omohyoid, left side, and you can see pretracheal fascia on the left side, and on the right side of the picture you can see thyroid gland, esophagus and trachea. Next we are discussing about vasculature. The thyroid gland secretes hormones directly into the circulation and is highly vascularized. Next you can see arterial supply of the thyroid gland. The arterial supply to the thyroid gland is via two main arteries. The two main arteries are given below, that are superior thyroid artery and inferior thyroid artery. First of all, we are discussing about superior thyroid artery. Superior thyroid artery arises as the first branch of the external carotid artery. It lies in the close proximity to the external branch of the superior laryngeal nerve, innervates the larynx. This is superior thyroid artery. Next you can see inferior thyroid artery. The inferior thyroid artery arises from the thyrocervical trunk, a branch of the subclavian artery. It lies in close proximity to the recurrent laryngeal nerve, innervates the larynx. In a small portion of people, around 10%, there is an additional artery. Which is additional artery? You can see the thyroid ima artery. This is an additional artery in some people, around 10%. This additional artery arises from the brachiocephalic trunk and supplies the anterior surface and isthmus of the thyroid gland. This is all about arterial supply. Next, you can see the venous drainage of the thyroid gland. Venous drainage is carried by the superior, middle, and inferior thyroid veins, which forms a venous plexus around the thyroid gland. The superior and middle veins drain into the internal jugular vein, and the inferior empties into the brachiocephalic vein. Next, innervation. The thyroid gland is innervated by branches derived from the sympathetic trunk. These nerves do not control the secretion function of the gland. The release of thyroid hormones is regulated by pituitary gland. The pituitary gland can regulate thyroid hormones to release. Next, lost in the end, you can see lymphatic drainage. What's lymphatic drainage? Lymphatic drainage of the thyroid is to the paratracheal and deep cervical nodes. So friends, this is all about, you can say, about the thyroid gland. So inshallah we will meet in the next video. Kindly subscribe my channel, like my video, and thank you so much.